Alice Mack is a dancer in her teens who has been training since elementary, middle, and high school. She's been training almost every day. However, one day she started waking up with some very severe joint pain. The doctors looked over her and they could not find anything wrong. They figured it was because of her grueling training schedule. But a couple of days later, she woke up with some very swollen knees and did some more tests, but they still couldn't find anything wrong. And then, several years later, after some more tests, when her condition worsened, as well as an MRI scan, they finally found out what was wrong with her. Alice had ankylosing spondylitis. So, ankylosing spondylitis is an inflammatory arthritis that affects the spine. I mean, this is a rather rare disease. So rare that I'm pretty sure no one in this class even has the gene that causes the disease. I myself have the disease and I've had it since probably I was 18, but didn't get it diagnosed until last year when I was 24. So I wish to spread awareness of this disease by talking about its history, the diagnosis, and the diagnosis and symptoms, and finally how to live with it and cure it. So let's get right into it and talk about the history. So it's not actually clear how long ankylosing spondylitis has been around due to how rare the disease is. In fact, like, let's see here, when they actually found some corpses, of the 560 of these corpses found in the Middle Ages in a castle, half of them had some form of spinal issue, and then out of those half, only 2 of them had ankylosing spondylitis. The The traits of this arthritis were not talked about or written in any medical literature until 1556, and then later they found another symptom of it, which the characteristic was eye inflammation. And then another doctor named Benjamin Brodie, also this is from Eve Ringer's book, described a case where a 27-year-old man had both eye inflammation as well as a deformation of his spine. It was a hoop-like deformation. Then between 1893 and 1898, 3 different doctors named Bermichius, Snapwell, and Pierre found similar diagnosis or cases between these 3 people, and they at the current time named the disease Bermichius disease, and it was detected as an arthritis at the time. The arthritis was also even easier to detect once the discovery of HLA genes were found out in 1950. HLA genes are genes that help the body figure out which proteins are good for it and which proteins are bad for it, like proteins made by viruses and bacteria. People with HLA-B27 gene however, his body are not able to distinguish as well. So now that we've talked about the history, let's talk about how to diagnose it as well as its symptoms. So diagnosing ankylosing spondylitis is rather difficult due to its rather wide array of symptoms. According to an article by Matthew Bunyard from the Cleveland Clinic, there are actually several symptoms associated with AS. One of the important features is that it is very common in people under 40, so it's between 15 and 40 that this would actually show up, as well as chronic pain of the back, morning stiffness, and even pain around the buttocks. But there's actually also other symptoms that even have nothing to do with the pain of the back as well. One of them is joint inflammation. So, main joints like the shoulder, the hips, and even the bottom of your heel could actually hurt. Another one is iriditis, which is inflammation of the iris, which causes blurriness, red eyes, and various levels of pain. And another rather scary one is one that causes inflammation of the chest, which can mimic that of a heart attack. So, when in order to diagnose this disease, a doctor must do several things. They must ask about a person's history, family history, so that way they know oh, what type of genes they have, as well as taking blood tests and MRIs and an X-ray. This would also help find the points in the spine if they notice there are any like smaller gaps or any fuse gaps, then they would be able to detect it. However, in early stages of the disease, it's rather hard to detect it, which is why, yeah, it's rather hard to diagnose this. And if it's not detected long enough and the person has not corrected or had any treatment for it, then the vertebrae in their spine may fuse, resulting in some very high levels of stiffness. Now, while this disease sounds bad, it's actually very rare for people to even actually have this disease. Out of 7 billion people in the world, only about 64 million will get it. And of the people with the HLA-B27 gene, only about 7%, or actually no, only about 5% of the people who have this gene will actually have this disease activate. Right. This disease also tends to be more common in men than it is women. So now that we've talked about the symptoms and diagnosis, let's talk about how to cure it, so as well as live with it. So due to how rare this disease is not it hasn't been looked into it much, but there are ways to live with it. So one of them is posture. It is best for people to remain standing, like straight, as well as sitting straight up, and they cannot sit hunched over. The next one is also regular exercise, as this helps the spine move around and makes the person more flexible. Swimming is also very helpful with this, as it reduces stiffness. According to M.A. Khan in his article, Anklylosing Spondylitis and the History of Medical Therapies, one of the treatments or attempted treatments was X-ray therapy, and the X-ray therapy is normally used to treat tumors as well as cancer cells. But while this worked, it also caused patients to have leukemia and another disease years later after the disease, so they stopped using it. There's no known cure for this disease. There's only treatments to reduce pain as well as increase flexibility. In the cases of people who actually have had their vertebrae fused, surgery would actually be the best option, as it would help save them from spinal cord damage. So to summarize, we just talked about the history of ankylosing spondylitis, the symptoms, and also how to live with it and treat it. People remember, ankylosing spondylitis is an inflammatory disease of the spine, a rare disease of the spine. It causes stiffness as well as the vertebrae fuse. People should not ignore this disease just because they should. People should not ignore this disease just because it is rare. They should be aware of it so that way they can treat it correctly rather than incorrectly and possibly making the disease worse. So in short, it is best to be aware of all diseases that could have severe negative effects on life, because if not treated correctly, you or a family member's health could easily get a lot worse. Thank you for your time.